Good evening, everybody. It is Thursday, April the 16th, and I want to start off, as I usually do, by sharing with you the daily statistics. So they're just updated in the nick of time. We did have 9 new cases reported today in Sonoma County. That brings us to a total of 172 cumulative COVID-19 cases. Of those 172, we have 83 recovered, 87 active, and we still do have those 2 fatalities, unfortunately. I'm actually going to try sharing the statistics in percentages tonight, and you guys can let me know what you think and if you prefer having them just in the raw numbers. But I think that sometimes, when we have odd numbers like 172 cases, it's a little bit easier to just kind of digest that in statistics that are in percentages. So we've got 56% female, 44% male so far. And of those 172 cases, 12% have required hospitalization and 88% have not required hospitalization. Looking at our age range breakdown from ages 0 to 17, that comprises 8% of the cases. From ages 18 to 49, that comprises 47% of the total cases. From ages 50 to 64, that comprises 27% of the total cases. And then 65 and up is the remaining 19% of the overall total. Looking at it by region in Sonoma County, Central Sonoma County comprises 56% of the cases, West County 9%, North County 10%, South County 13%, East County 9%, and then 3% remain under investigation. When we're talking about sources, and this is a trend that we have been noticing, is that the sort of majority of our sources are coming from close contact to confirmed COVID-19 patients. So community spread only accounts for 15%, travel for 24%, and then close contact is 46%. And we have 16% that remain under investigation today. I want to acknowledge tonight the challenges and the struggles that both out-of-work employees are feeling, but also in particular our small businesses. I know that there's a tremendous amount of frustration. The PPP or Paycheck Protection Program has run out of money, and I have heard from so many business owners who are unable to access that program locally. Number one, we were disadvantaged by actually being on the West Coast and being 3 hours behind the East Coast. Number two, we have a lot of independent banks, which are fantastic, and we love them, and they do great work here. But there were some issues with kind of getting the more independent banks having access to that program. And then finally, we also have a lot of rural businesses who don't have access to high-speed broadband and are trying to, fill out different forms and trying to coordinate and communicate with everyone, and that can present challenges as well. I do also want to acknowledge the challenges that are being experienced by folks who are trying to apply through the EDD, who are self-employed or who are independent contractors or who own their own business. Now, per the CARES Act, these folks should be eligible for that $600 a week that I know that our Democratic representatives fought very hard for. Unfortunately, that will not be up and running until April 28th. So it could be earlier, but that is sort of the deadline that the state has set, that as of April 28th, that is when our self-employed and independent contractors will have a system that is up and running, set up by the state of California so that they can apply for that money. The money will be retroactive, so even though you're going to have to wait, you will actually have that money available, and it can be retroactive as far back as February 2nd. And the state is also promising a 24 to 48 hour turnaround rate at that point in time. So that would be really good, and I recognize it's very challenging to have to wait a while longer, but hopefully once that system opens up, it'll be much more quick. Some of the sort of statistics that I want to share with you that are not the standard statistics tonight kind of show the extent of the need. The Santa Rosa Metro Chamber set up a small business grant program to try to get $2,000 directly into the hands of small businesses who are struggling to deal with the impacts of COVID-19. They, I think within just a few days, had 988 applications for that grant program, and they had only raised $75,000. So in order to fund all of the applications that they're receiving, they would need about $2 million. And so we're going to be working with them and seeing if we can identify additional sources of funding. And even though it's run through the Santa Rosa Metro Chamber, I want you to know that it's actually available to businesses countywide, whether or not you're a chamber member. So it was really neat that they set up this program, and I'm hoping that we can work with them to try to, do some fundraising to help support our small businesses. While our small businesses are struggling, we're actually, though, still struggling with people who are out-of-area tourists who should not be coming to visit our communities, but unfortunately they are anyway. So I actually learned from Bert Whitaker today that just out on the coast, there have been 2,000 people who have received warnings just in the last 2 weeks for being where they're not supposed to be, because right now, the state and local beaches on the coast are closed. And of those 2,000 people, 95% were out of town. So 95% did not actually reside in Sonoma County. So it's a little bit frustrating that we continue to see these out of area visitors coming in, and it's impacting our small towns in terms of supplies and also in terms of the potential to create further spread of COVID-19. But the good news is that at least in Sonoma County, most people are not actually going to the beach. They are following the shelter in place order. Moving along, I wanted to provide a couple of highlights. We have had 2 new health orders since I last spoke with you. Number 1 is regarding mandatory masking, and that will go into effect tomorrow. And that means that you need to have a cloth facial covering basically whenever you're out in public and you might come into contact with any person. So, we are not requiring, if you live down an empty street and you want to go for a walk and you don't think that you're going to see anybody and you're walking by yourself, you don't have to wear a facial covering. But if you do, you want to bring it with you so that in case you see someone that you're able to put it on. And you definitely need to use those facial coverings whenever you go into a grocery store or into a place of work where you're going to be coming into contact with other people. It's also really important to remember that just because you're wearing a facial covering does not mean that you don't have to social distance. You have to social distance and you have to wear your facial covering. The second new public health order is actually coming out tonight, and that is around congregate care settings. So that would be your assisted living facilities, your skilled nursing facilities, places where you have people who are living, and they tend to be sort of higher risk demographics, all in one facility. And so surgical masks are going to be required for anyone who is a care provider in that facility, and also anyone who is a provider in those facilities will have to have mandatory symptom screening. That means they'll actually have their temperature scanned when they enter those facilities, because unfortunately we have had a couple of employees in these types of congregate living settings test positive, and luckily, that was actually caught early. So it was caught when they were asymptomatic, and we were actually doing surveillance testing proactively. And so far it doesn't appear that they actually did spread the disease. So that's very good news that the system is working. But there remains a very high potential for spread in those kinds of settings. And so we want to make sure that everyone is kept safe there. Those are the major county updates that I wanted to share with you. And with that, I will turn it over to the questions. I know my husband is trying to follow along, and I will look at him to see what questions we've got coming in.
About what's the percentage of the county population infected, which I think is 0.03%.
Okay, my husband did I think a little bit of back of the envelope math, and he said that it is 0.03% of the population in Sonoma County that has been infected with COVID-19. And I also wanted to let you know, we've been getting lots of questions about antibody tests, about the accessibility of testing. Really, one of the primary ways that we're going to be able to move forward with loosening the shelter-in-place order, which I all know that we are all waiting for that moment eagerly, is we have to have adequate testing. So we are working on sourcing not just 100,000 swabs. We've got 100,000 swabs coming from one source, 10,000 coming from another, and we are also aggressively pursuing the antibody testing, which is not widely commercially available yet, but Dr. Mace is trying to make personal phone calls herself, seeing how she can get hold of these tests as quickly as we possibly can to get a better sense of exactly who has been through this, right? But maybe didn't actually get tested with the first round. So the nice thing about the antibody testing is that it will be able to tell us who had the test that might have gone, who had the disease that might have gone undetected by the lack of testing early on. So that will really give us a sense of what is the extent of the COVID-19 spread in Sonoma County. Other questions?
Couple people asking when the parks will be open and beaches.
Some people are asking when the parks and beaches will be open. I want you all to know that I have been on the phone almost daily with our regional parks director, Bert Whitaker, and they are working on what could be sort of a soft reopening of the parks. I should have more information about that in the next few days. There is not a firm date set yet, but what I think that you can probably expect is something that might allow you to just access those parks that are within biking or walking distance of where you are. Again, this is not formal. There is no sort of official announcement yet, but I've just been going back and forth with him a lot, and that's kind of the direction that some of the other counties in the Bay Area have taken, and they've had some success. Marin actually has an order like that where you're not allowed to drive to the parks, you're not allowed to use the parking lots, but it at least allows you to bike or walk to the parks that are in your neighborhood. I know I, for one, I live actually pretty close to Forestville Youth Park and El Molino High School, and I would love just to be able to take my kids out there to run around and fly kites and just be anywhere but my house. So I think that we're all eagerly awaiting the reopening of our regional parks, and hopefully that will happen soon. But again, lots of conversations happening right now between public health and the regional parks department.
Similarly, when can people go back to work?
Question about when can people go back to work. This has been a top question that I've been asking, and Supervisor David Rabbit and I have been on the phone daily with various business leaders and industry leaders in Sonoma County, as well as just small business owners who are really, really concerned. And one of the things that I find frustrating is that, in order to really be aggressive, right, and sort of tackle this issue head on, we, with our public health officer, decided to sort of what were non-essential and what were essential businesses. And so essentially all non-essential businesses were ordered closed. But the thing about non-essential versus essential is that it doesn't actually dive down into what is the risk of transmission of disease. And so I've really been asking our public health officer, could we take a more nuanced approach where we really look at what are the risk of transmission of various small businesses? And it might seem like a silly example, but the example that I've been using a lot is the example of a mobile dog groomer, right? Right now, mobile dog groomers are not allowed because they are non-essential. And yet you could set up a system wherein you let your dog out into the yard, you have a mobile dog groomer come, right? They wash your dog, they do whatever they're gonna do. They can wear gloves and PPE if we're worried that the dog could be a vector, and then they let the dog back. And you could actually pay online, and you would never even actually have human-to-human contact. And so what I'm really hoping for, and what I've been advocating for, even though it's not my decision, it's ultimately the decision of the public health officer, is I've been advocating for a more risk-based approach, where we take a slightly more nuanced look at what are the dangerous sort of settings and dangerous behaviors that could actually lead to increased rates of transmission of this disease. Okay, those are the things that we definitely can't do, right? So huge giant concerts, huge giant parades, large events where you have thousands of people together, we know that that is not going to be a good idea for the foreseeable future. But what are the lower risk activities, right, that could take place where you don't have as many people coming into contact with one another, but it allows people to just get back to work, to get back to their livelihoods, to start getting that paycheck so that they're not having to worry about putting food on the table and paying their rent and paying their utilities bills. So we are having those conversations right now, and I have really, asked that we sort of think very carefully about what should be allowable and what shouldn't be allowable, and how we can lift the shelter-in-place order. It will probably happen gradually, right, over time. But I just know that everyone is very frustrated right now in the community and feeling, a fair amount of economic anxiety. So we're doing what we can. I'm staying in touch with as many small business owners as I can to hear their perspectives. And the great thing is that small business owners and people across the county, they want to do the right thing. They say, you know what? Tell me what the rules are. I will follow them, right? Is it, we all have to wear masks all the time. We all have to stay 6 feet apart. Our restaurants can only operate at 50% capacity. There are lots of ideas coming out of the business side of things. And so that's kind of one of my goals, is to get some of those ideas over to the public health department so they could say, hey, yeah, that would work. Or no, that doesn't quite hit it. I think it would still be too risky, so we shouldn't go forward with that. So it's a process and it's ongoing. All right.
Keep your answers shorter.
My husband's admonishing me to keep my answers shorter. I will try.
Just a request for the next public health officer's order. Please include specific language prohibiting vacation use of second home not buried in the Q&A below the order.
Okay, and this was a request regarding the use of second homes and trying to clarify that in the public health order as opposed to burying it in the FAQs. And I apologize that the FAQs are buried on the SoCo emergency website. Leo Chi in my office has been advocating to try to get them to be more visible. And I did actually raise the issue of the second homes in the existing public health order, but they felt that it was better kind of placed in the FAQs. But thank you. I will pass along that feedback to Dr. Mace for the future. Next question.
Do you know the age range percentages for those who are or who have been hospitalized?
This is a great question. Do I know the age range or percentage for those who have been hospitalized? And unfortunately, I don't. That is information that I've been requesting, and I thought that it was going to come with the tranche of new information that was provided, where we actually now have the symptoms listed as well on the county's website of, kind of what were the different percentages of people who experienced certain types of COVID-19 symptoms. So I will follow up on that, because I do think that that is very interesting information that we should all have access to. So I will follow up on that one again. Next question.
What is the criteria to be considered recovered? Are they retested and come back negative?
That is a great question. So the question was, what is the criteria for being considered in the recovered category? Are they tested negative? And I actually don't know the answer to this question, so I will also ask Dr. Mace that question and get back to you. I do know that in general, I think they're looking at a 14-day time window for sort of, the disease running its course. But I will double check and see if the recovered folks have actually been retested and actually no longer have the disease present in their bodies. So great question. Next question.
Is a goal to have enough tests at some point for anyone in Sonoma County to be able to get tested?
The question is, what is the goal in terms of testing? Is the goal that anyone in Sonoma County could be tested at any point in time? And one thing that I want to remind everyone is that a test is not a guarantee of whether or not you're going to get the disease. It is a snapshot in time. And there have actually been instances in which someone tests negative one day and they test positive 24 hours later. And they actually probably had the disease the prior day, but they just didn't have a significant enough viral load to actually turn the test positive. And so I think the goal is to be able to do aggressive surveillance testing. What this would mean is that in settings where you're likely to have high rates of transmission, you would routinely test not only symptomatic folks, but asymptomatic people as well. Those would be settings like the congregate living facilities that I was describing earlier. It could be the jail. It could be all of our healthcare facilities, first responders, folks who are coming into high contact with other people on a regular basis. And then of course, folks who are symptomatic, even if they don't have a defined transmission source, would immediately be tested. We also, what we would be doing is taking anyone who does test positive for the disease, or even potentially is symptomatic but has a pending test result, and actually test all of their close contacts. And what I learned from Dr. Mace this morning is that actually you want to test them on about day 7. So it seems like it takes sort of about a week for folks to, be more likely to test positive if they're going to test positive. So that's kind of what a more aggressive testing scenario would look like. It doesn't necessarily mean you're going to test every single person in Sonoma County every week, because that would be a waste of resources, because you really want to kind of think about who would be more likely to have it or not. Next question.
Are we talking a few weeks before we have antibody testing or a few months?
Great question. So the question was, are we talking a few weeks before we have antibody testing or a few months? I did ask Dr. Mace that question. I said, is it a week? Is it a month? Is it 6 months? And she said that she was really hoping and really working towards a week. But it's, I think that there's a lot of jockeying happening in terms of, counties all trying to get this test as quickly as they possibly can. But I'm hoping that her optimistic response of a week is accurate. And if not, I'm hoping that it is a matter of a couple weeks and not a couple months.
I've heard many have no symptoms with positive tests. Besides temperature tests, will there be a way to work with immunocompromised people, particularly special education?
This is a great question. So the question was sort of what kind of testing can we utilize for immunocompromised folks, potentially people who are working with special education. Temperature scanning is being utilized, and that is part of the scanning that we are going to be sort of requiring, actually mandating through the public health order that Dr. Mace is issuing tonight regarding congregate care settings. And so that will be sort of requiring surgical masks, as well as symptom screening that does include every time you go in there, you get your temperature scan. And that's actually, I get sort of allergy shots at a medical facility in Santa Rosa, and they also actually scan every single person who walks in that office to take their temperature with one of the scanners that you don't even have to touch them. So I think that is going to probably become a standard of care as we look at, lifting some of these shelter-in-place orders and implementing other mitigation measures. But that, and then you've got the antibody testing, and you've got the sort of more standard testing, and those are really the best ways that we have right now at this point in time of scanning people for potential COVID-19.
Are they thinking of plans for what might happen if we're still sheltering in place and we need to evacuate as we did in October?
This is a great question. So are we thinking of plans for what might happen if we are still sheltering in place and we need to evacuate like we did in October of this past year with the Kincaid fire? And yes, we are. This is actually one of the first questions that I asked our emergency operations center and our emergency manager, Chris Godley. I said, what are we going to do if we're still in this situation during fire season? And so they are actually working on a full-length plan for that I believe they will probably present to the Board of Supervisors. It will be an amendment to, one of our existing annexes where we have one around pandemic and we have one around fire, and now we're going to have one that is, fire season in light of a pandemic. I am sincerely hoping that we are no longer under shelter in place in October, but we will likely be under some kind of, modified social and economic structure, right? We're not going to go back to things are completely normal, but we will likely have more economic and social functioning than we do right now, just with mitigation measures in place. But I do want you to know that we are absolutely thinking about that. And also vegetation management, even though landscaping is currently classified as a non-essential business, if you are doing work to reduce your fire danger, that is an essential activity. And so you can go about, clearing brush, getting a wood chipper over to deal with trees, making sure that you have dispensable space around your house. Because right now, of course, with those little bits of late rain, we all have a lot of vegetation growing in our yards and in our areas.
Some dashboards say Sonoma County has 2 deaths. Some say 1 death is a cruise death, double counted.
Good question. So we have actually experienced 2 fatalities in Sonoma County. The question was, just to repeat it briefly, is that some areas have said that we have 1 fatality and others have said that we have 2. And unfortunately, we did have a second member of our community pass away. And there wasn't a press release that was issued by the county, and some people criticized the county for not issuing a press release when we had the second fatality. It was sort of decided early on that after the first that it would just be put online, sort of there's no easy way of doing this. It's a very sad thing, I think, when someone passes away, and for them to be just reduced to a statistic on a website feels very sort of inhumane, because this was a person who was loved by the community. This is a person, whose death is being felt by their family and by their loved ones. But for whatever it's worth, that is what the county decided to do, is that additional fatalities will simply be included in the daily report, sort of as part of the graphs and the charts on socoemergency.org. So I welcome your feedback if you think that there is a more sensitive way of handling that. I'm always happy to take that information back to our public information team.
I think you kind of answered this already, but is there a plan in the works for small businesses that can social distance from clientele to open up under one customer at a time or curbside?
Is there a plan in the works for businesses who are currently not allowed to be open to open if they can, if they can be safely social distancing, if they can limit their number of customers, or if they can do curbside drop-offs? And I would say these are all of the conversations that we are having right now. And David Rabbit and I are again talking to businesses about what kinds of best practices could be implemented, and then trying to relay that information to Dr. Mace to consider it. She looks at, what the next public health order will look like. My personal goal is to try to make sure that we are all safe, but also to try to, get back some of our economic function, right, that we currently don't have access to. So looking at how can businesses have creative solutions to try to make sure that they are addressing the needs of public health, but also able to keep their employees employed and keep serving their community. I mean, I think there are a lot of us who would love to, rather than having to source things online or just not source things at all, to be able to get something from our local stores. And unfortunately, not all of our local retail stores have online commerce. So, number one, we can try to help them with tools to be able to sell things online, or, be able to place online orders and then pick up at a set time. But I think it's really critical to try to get our businesses back and to try to make sure that we are all able to invest in the local economy as well.
Following up on that, how can adults go back to work now when children are schooling from home until June? Is there any plan?
This is a great question. The question is, how can adults go back to work when their children are being homeschooled at home right now? There have been conversations, actually, which is very interesting to me. For the first time, I heard Dr. Mace talk about, children as a potential way of developing herd immunity, as opposed to how we've been thinking about children in the past, which has been, children as vectors that could potentially harm vulnerable populations. And so there have been conversations about, how can, preschools are actually allowed to operate right now, but only for essential workers and with a set number of children. But there have been conversations about, how to open summer camps where, maybe it's not just sort of summer camps wherever you want to go, but summer camps where you have the same number of children in the camp, right? And you're not sort of switching staff. And so there is actually a conversation happening on the public health side that if since children don't seem to get horribly sick with this illness, if they are kind of gradually potentially exposed over time, they could actually be factors to help us overcome the illness. And so I think that there are a lot of competing theories about how best to develop herd immunity or wait for the vaccine, and what is the timing of the vaccine, right? Those are the two big things that would really get us back to normal. That would be either herd immunity which is either comes from, the natural herd immunity or from a vaccine. And so just wanted you to know that there are some various philosophical discussions happening around the topic of children. But I do think that we will see childcare sort of start to come back online in a way that can support those parents returning to work.
This is a follow-up on something previous. Is there a way the county can change that age category 18 to 49 to something?
Oh, yes. This is a great question. And I actually did ask this question, and Dr. May said that she could do it, but I haven't seen the change happen yet. And this question was, can we get the category of ages 18 to 49 into something that's a little bit more narrow so that we can really see, what's happening and say, 18 to 35 and 36 to 49 or something to that effect. So I will follow back up on that one as well, because I did ask about that a while ago and I thought they were going to make the change and it never happened. All right, next question.
What's the status of trailers for our homeless community? Are they still sitting at the fairgrounds unused?
This is a great question. So what is the status of the trailers for the homeless community? And I actually was I'm glad to report that those will actually be utilized this upcoming week. So I think Monday and Tuesday are going to be the big move-in days. And also our alternate care site at Sonoma State University will also have the capacity for about 300 unsheltered vulnerable residents. So these are folks that we are triaging, and so those homeless residents who are more vulnerable to the impacts of COVID-19 will have the opportunity to move into shelter over there. So the good news is that, in short order, we are going to hopefully get about 320 people inside and off the streets. And so I hope that this is just the start of a larger movement. And we're also having conversations still about, could the county actually step up and buy a motel or a hotel so that we could actually not just, pay to rent a space for a few months and then kick people back out when the pandemic is over, which doesn't feel right, but to actually invest some of the money that we would be spending anyway to rent something, but rather to buy that so that then we would actually be left with the capital infrastructure at the end and we wouldn't have to kick people back out on the streets. So we're actively investigating what kinds of facilities might be for sale so that we could actually expand our homeless shelter capacity in Sonoma County.
Maybe you already answered this. What's the status on surveillance testing? Did you already
Question is, what's the status on surveillance testing? Surveillance testing is actively taking place. And so we are proactively testing contacts of confirmed COVID-19 patients. We are proactively testing some of those higher risk areas. Again, those would include, congregate living facilities, healthcare workers, first responders, jail inmates, and also our unsheltered population, because we recognize that things could spread very quickly in some of the folks who are currently living in encampments. So also wanted to mention that we are working on food provision and also sanitation for the encampment. So there were 30 hand washing stations and porta potties sort of deployed out to various parts of the county, and we're also trying to work with nonprofit organizations on food delivery and mass delivery. Actually, I want to give a huge shout out to North Bay SOAS. There have been two different groups that have really inspired me over the past few days. One of them is North Bay SOAS. These are folks who are just spending their whole day sewing masks and then giving them away to first responders and to vulnerable members of our community. And they're just doing it in this amazing grassroots way, organizing online. Someone's getting supplies, another person's dropping off masks, and then they're getting delivered, right out to the front lines. And so they provided some masks that I was able to drop off at the public health department to hand over to our homeless folks who are going to be moving into shelter this early next week. I also want to give a shout out to Mark Weiss at Raymond's Bakery, just because he's an amazing human being. And this man has been baking every day and giving fresh bread out to the Redwood Empire Food Bank, to Waves of Compassion, to some of our homeless shelters. I mean, this is how we're going to get through this, is just person by person, people doing good things. So big shout out to Raymond's Bakery and providing just everything from his focaccia pizzas to, loaves of sourdough that he's making sure that folks who are waiting in long lines. I don't know if any of you have been by some of the food distribution sites, but there is a tremendous need for food in our community right now. People are parked, blocks upon blocks upon blocks. And so it's heartwarming when you see someone baking fresh bread so that person who has waited in line potentially for hours to try to get food to feed their family has some bread that was handmade in Cazadero with love. So next question.
Can you please address sanitation district $81 rate hike? Really not good.
This is a good question. So this is a question that's not particularly a pandemic related question, but there was a question about the rate hike for the sanitation district. and I would assume that this is the Russian River Sanitation District. Now, for a long time, we have had major challenges with a lot of our sanitation districts in West County because there just aren't enough ratepayers to sort of be able to spread the cost burden of keeping up with all of the changes at a state level. The state is always setting the bar higher and higher with respect to water quality that can be released back into the environment. And so there have been mandated improvements to the system at Russian River in particular, but Occidental is a whole other sort of challenge. I actually had a phone call about the Occidental Sanitation District and how we can potentially look at trying to make that more cost effective in the future as well. So it's been about 5% a year, I think, since I've been in office on the Russian River Sanitation District increases. And the goal is actually to avoid a bigger spike. So, we try to sort of fight to keep it consistent and a little bit predictable, but I do recognize that it has an impact on people's wallets over time. So if you ever want to talk about sort of sanitation or septics, I have learned a lot and I would be happy to talk to you. So feel free to email me at linda.hopkins@sonoma-county.org if you want me to follow up on the challenges that we're facing with respect to wastewater infrastructure, especially in the lower Russian River and rural West County.
Do you know anything about cross-country travel and when that might?
This is a really great question. Do I know anything about cross-country travel and when that might sort of come back? I do not. I know obviously that we are, far down on our usual flights at the Sonoma County Airport, although I have had some people say, hey, thank you, this is great, I'm not missing the airport noise. But I do not have any information about national travel at this point in time, and I could reach out to our sort of Congress people to check in on that one. Let's see, I just see one that says, what's the best way for us to donate food for those in need, or would dollar donations be better? I think that at this point in time, dollar donations would be fantastic. Redwood Empire Food Bank, Ceres Community Project, Food for Thought. If you donate to any one of those three organizations, I can guarantee you that your dollar will be turned into great food that will be going to some of the most needy people in our community. So highly recommend those three organizations in particular. Russian River Alliance is also handing out grocery cards and also doing some work with Bill's Taxi in the lower Russian River to ensure that some of the food that's being distributed can actually get to people who are housebound and unable to access those drop-off locations. But yeah, for sort of big scale, county-wide stuff, I would go with Redwood Empire, Food Bank, Ceres Community Project, or Food for Thought because they do serve county-wide and they have different targeted audiences. Other questions? I miss trying to scroll through. I do see one about any possibility of limited opening of parks. And I did mention that I do anticipate us seeing some loosening of the parks regulations in the near future. There's been no formal decision made yet, but I've been in very close coordination and contact with our regional parks director and also been touching base on a state level as well because we do have state parks that are also impacted by the shelter in place and the parks closure order.
What about the Rio Nido Lodge for housing?
Question about what about the Rio Nido Lodge for housing? Something to look into for sure. I don't know if the owner is interested in providing that service, but I have had a number of folks reach out to me to say that they would like to be part of the solution. So definitely open to anyone putting their hat in the ring, and I will pass that on immediately to the Emergency Operations Center and the Alternative Care Sites team. Okay. All right. It sounds like we are wrapping up. So just going to try to scroll down. A lot of question about the parks and beaches. So I will definitely take that back and just know that we are working on plans for how we could reopen the parks and how we could sort of make sure that there are those safety measures in place. Thank you all for joining me. I hope that you have a good night. Please always send me an email, district5@sonoma-county.org. That's 5, the number 5, not the letters, or linda.hopkins@sonoma-county.org. We are trying to respond as quickly as we can to all of the emails that come in. If you need resources, go to socoemergency.org. We now have a virtual local assistance center, so you click on that up in the sort of top right corner, and that will direct you to a whole bunch of resources, including how to apply for unemployment, where the different food distribution sites are around the county, what are the small business resources, how to get hold of our Economic Development Board. We want to make sure that we can connect you to resources, even if we don't have them available on the local level. We're happy to point you to state or federal resources as they become available. Be well, everyone. We're in this together. We're going to get through this together, and let me know what I can do to help you. Take care and have a good night.